Hello and welcome to week 4 after your tummy tuck, gentle breath work and meditation practice. My name is Kathleen Helen Lisson. I am a lymphedema therapist. I'm also board certified in therapeutic massage and bodywork, and I'm a yoga teacher. Today, we are going to be doing two different types of breath work. We're going to be doing an awareness of sound meditation. So if you have symptoms like anxiety, breathing problems, cardiovascular or blood pressure issues that you think would preclude your ability to do a breath work practice, definitely talk to your plastic surgeon before you start this or any other practice. And even if you usually love breath work, if for the past 3 weeks you've really been doing well with these sessions, but today you feel anxiety, you feel lightheadedness or dizziness, a rapid heartbeat, shortness of breath, or any other symptom, let's listen to our bodies and go ahead and stop the practice for today. And for some people, it's best to practice this type of breath work on an empty stomach. We'll be taking a little bit of deeper breaths using our diaphragms today. If you feel uncomfortable when you're breathing deeply on a full tummy, you could perhaps try practicing in the morning before your breakfast. So we'll start with some gentle movement and breathing pairing together. So we'll do some neck and shoulder range of motion. So we'll start with an inhale as we look up and an exhale as we look down. If you want to, you can put your hands right at your collarbone. Inhale as we look up, feel the stretch of the skin. Exhale as we look down. Inhale as we look up. Exhale as we look down. Now return to center and inhale and tip the head to the right. Exhale, the head can come back to the center. Inhale, tip the head to the left and feel that stretch here. Exhale and come back to center. Inhale, tip the head, feel that stretch. Exhale, come back to center. Inhale and exhaling. Inhaling one last time to the right. Exhaling to the center. Inhaling, tipping the head to the left. And exhaling back to the center. We can take our hands and put them in our lap. And then inhale and turn the head to the right. Exhale, come back to center. Inhale, turn the head to the left. Exhale, coming back to center. Inhaling, looking to the right. Exhaling to the center. Inhaling to the left. Exhaling to the center. And then one last time, inhale to the right. Exhale to the center. Inhale to the left. And exhale to the center. On our next inhale, we'll bring the shoulders up and back and exhale down and forward. Shoulder rolls, inhaling the shoulders up and back, exhaling them down and forward. Inhaling and exhaling with the shoulder rolls. 2 more here. And then at the top, we'll change the motion. So we'll inhale back, forward, exhale, down and back. Inhale, up and forward. Exhale, down and back. Inhaling and exhaling. Shoulder rolls in this other direction. Kind of feeling how much we can rotate in the shoulders, moving this part of our body gently and according to the breath. All right, so exhale, and on the next inhale, raise the shoulders up, up, up. And then exhale and slowly let them rest. And feel the difference in your neck, in your shoulders after this short, mindful breathing and movement technique. And now we'll move into 5-5 breathing, our old friend here. So I'll invite you to begin in a relaxed yet alert position. Your eyes can be open or closed. We're going to inhale for a count of 5 and exhale for a count of 5. We're going to repeat that for 5 minutes. So that's 30 breaths total. I will keep the time for us, and we'll start with an exhale. And then inhale. Exhale. 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 Inhale. We're about halfway done. Exhale. Inhale. 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 Exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale and exhale. So that's the 5 minutes of this breath work. You can return to breathing in a natural rhythm. Your eyes can be open if they were closed. And I'll invite you to take a moment and feel into your body, feel into your spirit. How do you feel after this 5-minute breath work practice? And we'll move into an awareness of sound meditation. So you can close your eyes if you like, or they can remain open. We're going to take the next few minutes to focus on sounds in our environment. So we'll begin by taking note of the sounds in the room. We're becoming aware of sounds that are close to us. Now listen for sounds that are from outside of your space. We're becoming aware of sounds that are farther away. Now we'll expand to be aware of all sound. Sounds that are inside of our body, sounds that are close to us, and sounds that are farther away. We're becoming aware of all sound. As we bring this meditation to a close, I'll invite you to take a deeper breath in, a longer breath out, and we'll end by hearing from my singing bowl. I'll invite you to open your eyes and take a moment to note any changes in sight, in sound, and in your emotions. And now we'll move into a little bit of a newer breathing practice. This is called Viloma Pranayama, or staircase breathing. So we're going to inhale through the nose for 2 seconds, hold the breath, inhale more air, hold the breath again, inhale more air again. So we'll be about at a full lung, hold the breath for 2 more seconds, and then we'll do a long, slow exhale. So it's 3 separate inhales to fully fill the lungs, holds in between each of the inhales, and then a long, comfortable exhale. So we're going to do this for about 5 minutes, and I'll keep the time and cue us to when we inhale. So I'll invite you to start by sitting comfortably with a straight spine. You can close your eyes if that feels comfortable, and we'll take an exhale and then inhale, hold, inhale, hold, inhale, hold, and then a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, and hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. Inhale, hold, inhale, hold, inhale, hold it, and a long, slow exhale. We're about halfway done. Inhale, hold. Inhale, hold. Inhale, hold it, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold it, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold it, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold it, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold it, and a long, slow exhale. Inhale, hold. Inhale, hold. Inhale, hold, and a long, slow exhale. And we'll let go of that style of breathing. I'll invite you to take a deeper breath in and a longer breath out. And take a moment now as we come to the end of our practice today to feel into your body, your spirit, your feelings, your mind. How busy is the mind versus how it was at the beginning of this practice? See the difference that about 15 minutes of mindfulness can make in your day.